Good afternoon. Good afternoon, Rhode Island, and thank you for tuning in to our regular Thursday briefing. As a reminder, going forward, the weekly briefing will be every Thursday at 1 o'clock instead of Wednesday. And as always, for more frequent updates, I would strongly recommend that you sign up for our email list. It's a daily email, governor.ri.gov. So we'll begin today, as we always do, with the data, and I'd ask that you please put it up on the screen. No good news in this data, nothing good to share. The dashboard is before you. Yesterday, we had 1,330 new cases out of over 16,500 tests. That gives a percent positive of 8%. And very sadly, we had another 9 deaths. As you look at that dashboard before you, the data is very concerning. There's no other way for me to say it. We are far past the peak that we had in the spring, and this wave certainly seems to be much more dangerous than what we experienced in the spring, which is why I decided to impose new restrictions over the past 6 weeks, and why I decided it was necessary to begin a 2-week pause that began on Monday of this week. Here's my message about this data. It is not at all surprising. I have been up here warning week after week for a month and a half that this is what we were in for, and therefore it's exactly what we expected. You shouldn't panic, you should take action. And that's exactly what I'm doing. That's what we're doing. There's no purpose in panicking. These data are not good. A lot of people, I feel the panic. People are saying they're scared. It's scary. It is scary. This is a scary data. But don't panic, take action. The solution to changing the trend is totally within our control. We have the power to change the trend and save lives. It's following the rules, wearing our masks, heeding the pause, staying home, and cutting down our mobility, and just staying with the people we live with. It's really that simple. If we do that, this doesn't have to be scary. The numbers will turn around. So for those of you who doubt that we have a crisis, I hope this data is jarring for you and motivates you to take action. To those of you who are afraid, I would say there's no point in being afraid. There's no point in panicking. We knew this was coming. We are preparing. We are prepared. We're working around the clock. More testing, more contact tracing, more field hospitals, more staffing. We're moving into action. And that's what I'm asking the people of Rhode Island to do. Act, follow the rules, bend the curve, save lives. You can see percent positives increased from 6% to almost 7%. New hospitalizations increased from 326 to 384 cases. Total number of cases this week is slightly down from 629 to 563, but I think that's just a reflection of the fact that fewer people got tested over the holiday week. I don't take any solace in those numbers. We are trying to test as much as possible. We actually have a strategy of trying to find the positive cases, because now the solution is find positive cases, get people into isolation. Okay, so I'd like to begin today where I left off last week, which is to say thank you to the people of Rhode Island. In the week since I was last here, we had Thanksgiving. We had a long holiday weekend, and we have begun our statewide 2-week pause, which began Monday. And I would like to begin by acknowledging that none of this has been easy. Thanksgiving was hard. My kids said, "Mom, this is weird. It's unusual, it's unnatural. We miss our loved ones. Businesses are having a really hard time during the pause. We're reinventing ourselves, becoming resilient, getting our families through it. So I want to say thank you. I want to say thank you for getting through it together and bearing down and following the rules. There's some good news, though, which is that the early data suggests people are following the rules. So over the Thanksgiving week, our COVID enforcement unit did not receive a single credible phone call about large parties or gatherings. That's a good thing. We had been, a couple weeks ago, receiving phone calls. In about 700 business inspections over the past week, over 99% of restaurants and bars were observing the early closure requirement and had all customers seated. So thank you. Thank you for closing your bars. Thank you for closing early. 96% of businesses had proper social distancing. Nearly 100% of employees were correctly wearing masks at all times, and nearly 100% were complying strictly with capacity limits. Last week, a record high 55% of businesses received a perfect score for their inspections, and another 32% received a near perfect score. So that's fantastic. That tells me people are following the rules and hunkering down. And if that keeps up, that will work. We're also tracking, as I said I would, mobility data, traffic data. That's a really good way to tell, are people following the rules? And the traffic data shows a significant and steady decline beginning last Wednesday. Over the past week, traffic in Rhode Island was 10% less than the previous week. Now, it is true that we often see a decline over Thanksgiving, but this decline is double what we saw last year around Thanksgiving. For example, last year traffic around Thanksgiving was 5% less than the previous week. This year it's 10% less than the previous week. And the decrease in mobility has continued even more since the pause started on Monday. Over the last 7 days, we saw about 2 million vehicles, 1.9 million vehicles on the road in Rhode Island, which is not quite a 30% decrease from those 7 days last year. So why does this matter? Why am I in the business of tracking cars on the highway? Because we know mobility is a good indicator for cases. We've seen that in Rhode Island. We saw it in the spring. In the spring, we saw a drop in mobility about a week before cases started to decrease. By the way, you see that in every country and in every state around the country. Similarly, in October and November, we started to see significant upticks in mobility. And then a week or two later, we saw upticks in COVID cases. So this tells me people are following the rules, and you should too. Early data suggest Rhode Islanders are listening and pausing. They're staying home, working from home, not congregating, staying exclusively with the people they live with, wearing masks, and staying off the roads. The pause is working, people are following the rules, and you should too. So hopefully we continue to see a decline in mobility, which should lead to a decline in cases a couple of weeks from now. But we'll stay at it, and we will keep vigilant. At this point, I'm sure many of you want to know, am I going to lift the pause at the end of the 2-week period? I don't know. The answer is I don't know. I'm watching the data every single day. If it continues to look like this, mobility goes down, bars are closing, people are staying home, I would like to, and have intention to, at the end of the 2 weeks, slowly dial the economy back up. But today, I don't know. If we have to see if people keep following the rules. My biggest concern at the moment is overwhelming our hospital system. That's the risk. And so I'd like now to take a minute to go through where we are with hospitals. This week, we have opened both field hospitals. The field hospital in Cranston opened on Monday. The field hospital in Providence opened on Tuesday. As of last night, there were 7 patients at the Cranston site and about 20 patients expected over the coming days. There were 21 patients in Providence, with probably another 40 or 50 in the next coming days. I have been in touch with the heads of these hospitals, and they report to me that so far things are going very smoothly at these field hospitals. I want to thank Dr. Foreman and Dr. Sooner, both of whom were with me on the stage a few weeks ago. You guys are doing a great job. I'm sorry this is so tough, but thank you and your teams for this work. I will tell the people of Rhode Island that the quality of our field hospitals is about as good as it gets. I have seen some other field hospitals around the country, or I know of them, I see pictures of them, I know how they're set up. Some are in gymnasiums, some are were more quickly put together. Our field hospitals they are not real hospitals, of course, they are in the convention center, but they are top-notch field hospitals with top-notch professionals. We took incredible care to establish them in that way, and I do want to give you some assurance in case you or your loved one winds up in a field hospital. Having said that, the facilities are only as good as the people who staff them. I want to be very clear about this and send a special message to people who are still not following the rules. Right now, we have capacity in these 2 field hospitals for about 900 extra beds. But we can't staff them. We do not have the staff. We cannot see our way right now to safely, comfortably staffing 900 beds, which is why it is absolutely vital that we don't get to a place where they all have to be used. So the next time you think it's fun or funny to have a party, break the rules, shave the rules, I ask you to think about what it would be like if your mom or your wife or your husband or your best friend wound up in a field hospital that was improperly staffed. Because that could happen to you or a loved one if we all don't follow the pause in these rules. I would also say healthcare workers are human beings. Every nurse and doctor, physical therapist, mental health professional, certified nurse assistant, these are mothers, fathers, sons, daughters. These people have been working for 9 months without a break under incredible stress. They are tired, they are exhausted, they are strained. So I would just say they deserve our support. Furthermore, although we are trying every day to figure out how to get more staff, the brutal reality is every country in America, every state in America is struggling with staffing. So the fact is cases are spiking everywhere, and so we don't have the same access to out-of-state physicians and nurses as we did in the spring. I know some of you are saying, well, Gov, there's 900 beds and they're not filled. This is true, but what good is a bed if you don't have adequate staffing? To that point, I am calling on everyone in Rhode Island who can help with the crisis to help out. This week, if you're a healthcare professional. So this week, the Department of Health again began issuing temporary licenses to retirees, visiting healthcare workers, and others who are completing their training programs. So if you're hearing me and if you're a retired healthcare worker of any kind, or a healthcare worker who's currently underemployed, maybe have some time to spare, or unemployed, or working in a non-healthcare setting, I'm asking you to suit up and help us out. If you're willing to work on the floors of our hospitals or our nursing homes or our field hospitals, we need you. Calling all healthcare workers in Rhode Island. You can learn more about immediately available positions at the website skillsforri.com. And hopefully that's up on your screen now. Skillsforri.com. Or you could go directly to the lifespan.org website or the carenewengland.org website to learn more about positions at the field hospitals in particular. I will say that in the past, when I have put out the call for substitute teachers or contact tracers, within a day or two, we've had hundreds, if not 1,000 people raise their hands. So that's what I'm asking you to do now. All available healthcare workers, please raise your hand to serve in any way that you can. Right now, we need you. I also want to thank our schools of nursing at URI, CCRI, and Rhode Island College. We have over 100 student nurse interns and over 125 graduate nurses lined up to start supporting our hospitals to help us. So thank you to URI, CCRI, and RIC. Good news, those three colleges have top-notch nursing programs, of which I am so proud, and I'm proud of the students who are stepping up to serve. Finally, if you have physical or mental healthcare experience, but you can't commit to a full-time job in one of our hospitals, or if you don't have healthcare experience, but you want to volunteer to assist in other ways, we need all kinds of help in these field hospitals, as you can imagine, you know, meal delivery, there's many different ways we need help. Please visit riresponds.org, riresponds.org. We need volunteers. We need volunteers. We're really in the thick of it now. It's an all hands on deck effort. And so if you have some time and you have some energy and you want to help out as a volunteer in any way across our whole of government response, please go to riresponds.org. And I can assure you, we'll put you to work right away, and you'll be doing good things to save lives in Rhode Island. Okay, I'd like to take a minute to talk about testing and also vaccines. As I have said earlier, one way to keep from overwhelming our hospitals is to identify as many cases as possible, as early as possible, and get people into isolation, which is why we are extremely focused on testing. Last week, I announced a series of changes that we're making to make testing quicker and more accessible. And I acknowledge that over the past month, it has been hard sometimes to get a test. Sometimes it takes too long, you're not sure where to go. To address that need, we have really pushed a lot more testing into the system. And I want to tell you where we are today. On Monday, a few days ago, we opened a brand new Binax Now asymptomatic testing site at the Dunkin' Donuts Center. What's Binax Now? Binax is the easy, do-it-yourself, 15-minute, painless COVID test. If you haven't done it, do it. Trust me, it's painless, it's easy. It's brand new, open Monday, we have capacity, sign up, go get one. We have capacity to run 500 tests per day at the Dunkin' Donuts Center. By Monday, next week, we'll be up to 2,500 tests a day. We've also added capacity at some of our newer testing sites, including McCoy Stadium, where we've increased our daily testing capacity by 1/3, and we've significantly ramped up our testing capacity for Rhode Islanders with symptoms. Last week, I said that I wanted to have capacity to run 3,000 daily tests for people with symptoms by the end of the pause. I want you to know we're going to exceed that. As of right now, we're at 2,500 daily symptomatic tests through the portal. So this is confusing. I understand that. There's been a lot of changes, and testing hasn't always been perfect. Here's the bottom line. there's more capacity than ever to get a test. Even if 2 weeks ago you were waiting for days or you couldn't figure it out, it's better now, and I'm asking you to give it a try. If you feel sick, call your doctor, call your healthcare professional. They'll take care of you and they'll get you a test. But if you don't have a doctor and you feel sick, sign up yourself at our portal, portal.ri.gov. It's free, portal.ri.gov. Schedule it yourself. If you're not feeling sick, I still want you to get a test, especially if you work in a restaurant, hair salon, manufacturing operation. If you haven't been tested yet, if you did get together with family over the holiday, please, please, please go get tested. Sign up yourself. Go to the portal.ri.gov. It's simpler now. There's not a lot of requirements. They ask you 2 questions. Are you having symptoms? If yes, go here. If no, go there. We have a lot of capacity. So I'm asking you, everybody, please go get tested if you haven't. And by the way, we're going to keep adding supply to the system to really keep it moving. Additionally, we're doing an awful lot of work in our high density communities, most particularly Central Falls. And I want to thank the team who's doing that. We have expanded our testing capacity at Calcutt Middle School. We had a testing event for students at Ella Risk Elementary, and we are working to coordinate weekly asymptomatic testing at Bethel AME Church and Only Street Baptist Church in Providence. What we're trying to do in these highly dense communities, Providence, Central Falls, Pawtucket, is bring the testing to the community, in churches, in parking lots, in the community. So please go ahead and get tested. Okay, finally, I want to end with the good news, which is vaccines. And there is a lot of good news. There is a lot of good news on the vaccine front. There are 2 companies, Pfizer and Moderna, that are on their way to FDA approval for a vaccine that is 95% effective. Now, for those of you who aren't vaccine experts, which includes me, that's a miraculously effective vaccine. Much, much more effective than the flu vaccine that we get every year. 95% effectiveness. These vaccines have both gone through 3 clinical trial phases with over 70,000 participants, 70,000 people in them. And before they'll be coming to Rhode Island, they still have to go and get FDA approval. The FDA is following the same rigorous standards for these vaccines as for everything else. They are not lowering the standards or changing the process. So if the FDA approves these vaccines, you can have as much confidence in them as any other medicine that you might take or vaccine that we would have. Additionally, on top of that, all of the data, all of the clinical trial data, all of the safety data, all of the efficacy data is public. And we have our own team of experts in Rhode Island combing through all of that data, as an extra pair of eyes, people on the ground, Rhode Islanders who care about Rhode Island, double, triple checking to make sure that this is safe before we administer a single dose. I also want you to know that while this is happening, while they're developing the vaccines, et cetera, we are taking action on the ground in Rhode Island, so we have a plan. I was asked a week ago, how quickly, once we receive the vaccine, will we be getting it out to people in Rhode Island? Immediately is the answer. So we're already, and have been for weeks, working with hospitals to ensure they have the supplies and personnel to receive, store, handle, and administer the vaccine. We are already reaching out to doctors' offices, health clinics, pharmacies, and others to begin that same process. We're planning for every scenario and developing different distribution models based on the allocation that we receive. Also, the Pfizer and Moderna vaccines, they each have different requirements. That's a problem for us to worry about, not you to worry about. But I want you to know we're on it. We're on it. We know the details. We are on this every day, all day. They have different refrigeration requirements, different handling requirements, different travel requirements. We got it covered. We're working on it. We have a plan. Both of those vaccines, Pfizer and Moderna, which are going to be the ones available first, require 2 doses to be effective. Those doses have to be administered between 3 and 4 weeks apart. So you got to get one, and then we need you to come back within 3 to 4 weeks to get the second test, like a booster shot. So we are right now working day and night to develop technology systems and reminder systems to make sure people come back to get their second booster shot. And our data team is already working to build systems to keep the public informed about how much vaccine is in Rhode Island and how many doses will be administered. So I'm sharing this because, this is not a flip of the switch. I want to be crystal clear about this. What do I think? I think we will have some vaccine in Rhode Island by the middle of December. I do. I think, though, it'll be very limited initially and will ramp up over a period of months. And it's not going to be a flip the switch cure for everything that ails us. Our initial supplies will be limited. I'll give you my best estimates of what I expect based upon all the conversations we're having with Washington and our federal partners and the manufacturers. I think we could receive about 10,000 doses of the Pfizer vaccine in the next few weeks. I think we'll get about 19,000 doses of the Moderna vaccine probably a week after that. So by the end of the year, I think we'll have about 29,000 doses of vaccine in Rhode Island. Now, we're a state of 1 million people. 29,000 shots doesn't go a long way. So that's why we are prioritizing where those initial doses will be going. Those initial doses will be going to healthcare workers, first responders, high-risk individuals. If you want the details of exactly our plan, it's publicly available on the Department of Health's website, and we're consulting daily with the CDC and reviewing the ongoing guidance that they're putting out. We have a Rhode Island vaccine subcommittee, and they're overseeing the planning process for Rhode Island, and I'm going to continue to have more guidance in the days to come. But as I said, the vaccine is coming to us over the course of months, not weeks. And everybody needs 2 doses. So what's the bottom line? The bottom line is this. Help is definitely on the way. These vaccines are highly effective and highly safe, but they're going to trickle into Rhode Island over a number of months. They're not rushing into Rhode Island this month. And we're going to have to be very thoughtful about how we space out the administration. First to healthcare workers, nursing home workers, hospital workers, nursing home residents, etc. Bottom line is, for the rest of us, it's going to be many months before we're all vaccinated with 2 shots. So although the really strict regulations around the pause and closing businesses will be able to be eased up, we all need to settle in for months more of being careful, mask wearing, social distancing, and following the rules, which is why we are really investing so much to have incredibly robust testing and contact tracing, because we're going to be at it for a while. Some people say that the 3 best reasons to live in Rhode Island are June, July, and August. I happen to think every month's nice, but it is true. June, July, and August are pretty great in Rhode Island. So here's what I would say. By the time we get to June, July, and August, we're going to have a fantastic summer. And as I said to business owners, I hope some of the regulations that we eased up on to let you take your businesses outside and do more business, I hope that stuff is here to stay so you can make up some of your business next year. But I finally feel confident in saying by late spring, early summer, we're going to be really kind of back on track and out and about here in Rhode Island. In the meantime, though, we all have to keep following the rules. Okay, I'm going to turn it over to Dr. Alexander Scott, and then I will come back to answer all of your questions. Before I give it over to the doctor, though, I do want to say that I realize rumors are rampant, and yesterday there was a lot of speculation about me being considered to become the Secretary of Health and Human Services, and I did want to address that honestly with you, so we can have this press conference together focused on COVID and the business of Rhode Island. I am not going to be President-elect Biden's nominee for HHS Secretary. My focus is right here in Rhode Island, as I have said. I'm working 24/7 to keep Rhode Islanders safe and keeping our economy moving. And I have nothing else to add on that topic. But I'm going to come back and I'll answer all of your questions about COVID and what's going on in Rhode Island.
Thank you, Governor. Good afternoon, everyone. Thank you for being with us today. To get started with data, as the Governor shared, we are continuing to see elevated data in almost everything we track when it comes to COVID-19. Something else we have been watching is the geographic distribution of our cases across the state. We've talked a lot at this podium about some of our more densely populated communities, such as Central Falls, Providence, and Pawtucket. But it's important to make clear that we are now seeing case increases almost throughout the entire state. For example, Burrillville, Gloucester, Westerly, and Charlestown all have seen sizable increases over the last month. It does not matter where you live in Rhode Island. If you do not wear a mask with someone that you don't live with, and if you do not practice social distancing, you are putting yourself, your loved ones, and everyone else around you in serious danger. We really want to make sure, particularly during this pause, we get everyone's attention to recognize that and work with us together. We currently have 409 people hospitalized in Rhode Island with COVID-19, which includes the numbers the Governor shared from the alternate hospital sites, also referred to as the field hospitals. There are 45 people in an intensive care unit throughout the state and 31 people on ventilators in Rhode Island. Sadly, again, we have 9 new fatalities to report. One person was in their 50s, another individual was in their 60s, 2 people were in their 70s, 4 people were in their 80s, and 1 person was in their 90s. Our sympathies and prayers are with the families of these Rhode Islanders. Early on in the pandemic, the majority of our fatalities were associated with congregate settings, such as nursing homes. Now, we have seen increases in fatalities among people not in congregate settings. Again, COVID-19 is affecting every demographic throughout the state. The changes that you do in behavior will have an impact on you and your loved ones and those around you. Switching gears, I want to echo the governor and encourage people to take advantage of the testing capacity that is available in the state. We're continuing our SOS testing strategy and really expanding the availability for people who have symptoms in our outbreak response, as well as testing for asymptomatic people. Please take advantage of the testing site at the Dunkin' Donuts Center. The Binax Now rapid point of care tests that are used there are fast and they are easy. That's how our testing has evolved. We want everyone to know about it and to be able to take advantage of it. I actually just had a Binax Now test done today and had my negative result available to me within the 15-minute time frame that it can occur. And so I want to just show you how simple this can be. When you go to get tested, there's very minimal equipment and instruments that are required. The packet that is in place has a card which opens up, and it's quite simple. You open that card, and it will be laid on a flat surface where you will be tested. There are 2 holes in the card that are present. At the testing site, they will be dropping some of the liquid that is needed to run the test into the top hole, 6 easy drops that are there to be able to do the chemical analysis of the test. And then you will be taking the swab that is available for you. Sometimes people can self-swab. How easy this is. Swab each nostril and use that to collect the specimen. Very quick, simple. It's not as challenging as the swabs early on where there were nasal pharyngeal swabs that went far back into the nose. This is not as uncomfortable. It's quite simple. And that swab will be placed into the card and into the packet. It will be pressed in and then easily turned 3 times clockwise. These are the simple steps that will take place. An adhesive will be removed, the card will be closed, and it will be laid on a flat surface and monitored for that 15-minute time frame. I brought one from what I used earlier today that has the easy demarcation of the negative result. And that is what we are looking to really expand now throughout the state and want to encourage everyone to go get tested regularly. It is easy, it is available, and it is important. It's what will be used to help determine how to support you best in isolating and in informing contacts about quarantining. For people who have symptoms and have a negative Binax Now rapid test, we are recommending and will be making available getting a second PCR test to help confirm. We want to strongly encourage this easy, rapidly available mechanism for getting tested frequently and easily. I'll say that again. A separate issue I want to raise is about quarantine guidance. Just to touch on that quickly, the CDC has made public now new information on quarantining within the last 24 hours. In that new information, the CDC, Centers for Disease Control and Prevention, reiterated what we've been saying for months, that the gold standard for quarantining is 14 days. This is the safest thing to do for all of the people around you. But with recognizing the challenge over time and really digging in on the data, we are pleased that the CDC has been able to demonstrate the alternatives that can be in place for quarantining. We're reviewing this information that's been provided from the CDC and are looking to get in front of offering that to individuals. It would be whether or not someone has symptoms and if you're able to get a follow-up test to determine shortening that quarantine time to either 7 days or 10 days. So over the next few days, our team has already begun working on ways to apply this so that we can help improve compliance, make sure that as many people as possible get tested, and we help ensure that those individuals have the support they need to isolate and the close contacts have what they need to be able to quarantine effectively, and we stop transmission of coronavirus. All of this is critical in addition to the vaccine that is on the horizon. The other opportunity that I want to share and finish with is what's also on the horizon. Relatively new treatments that we have for COVID-19 in Rhode Island that we want to continue to spread the word on, available even as of this month, and they will continue to be available as we go forward. There are now better treatments for people with COVID-19, both for people who are in the hospital, but new now also for people who have somewhat milder illness at home. So they have not been admitted to the hospital, but can benefit from an intravenous infusion treatment that we're referring to as a monoclonal antibody. We're working very closely with our federal partners to receive the allocation, to talk about distribution plans that allow us to really expand this to multiple populations across the state, those who are hardest hit, and get access to additional treatments options that are coming through the pipeline. These and others are laboratory-made proteins, these treatments, that can mimic your immune system's ability to fight off viruses. We're getting data that's continuing to come through and demonstrate that this is increasingly helpful in limiting viral replication and can be effective in treating people with COVID-19 who are at high risk for progressing to severe illness. This treatment has great potential for certain individual patients, and it can help to keep our hospitalization numbers down as well. So we have many opportunities on the horizon that we want you all to take advantage of. The medication that I'm referring to is administered in an outpatient setting as an IV intravenous infusion, and you can get it once, and it takes about an hour to infuse. The treatment is available for an individual within 10 days of developing symptoms and prior to any need for hospitalization. There are a few additional key things to know. It is not a treatment to prevent you from getting COVID-19. It's again for people who already have COVID-19. It is also reserved for people who are older and who have other conditions that may lead to severe illness, such as being immunocompromised. You cannot just go to the hospital for this monoclonal antibody treatment. You must work with your primary care provider for this treatment. So if you think that it's right for you, please do that. But we're also communicating with doctors throughout the state. We had a call with hundreds of them yesterday so that we can coordinate this treatment with them for you as their patients. And we recognize that there are people who may not have a doctor. We are working with the same respiratory care clinics or urgent care centers that have been available for those individuals so that this treatment can be accessed there as well. Those clinics are listed with the testing locations on our Rhode Island Department of Health's website, which you can navigate to from health.ri.gov/COVID. The sooner you start this treatment, the more effective it is. You want to start it as soon as possible after a positive test for COVID-19. So I'll just finish with saying we know our vaccines are on the horizon. We have steps that we can take now to best prepare ourselves and really start to bend the curve. following the rules during this pause, making sure that you're wearing a mask when you're with anyone that you don't live with, understanding that if you're indoors with an inconsistent group, and in informal settings, that's where the risk for spreading COVID is the highest. And access the testing that's available. It's easy, showed it to you here, and access the treatment that's available. All are steps to prevent even going into the hospital. So with that, I am going to remove everything here and get us started with questions.
Paint a picture for us of where we're at in contact tracing right now, and kind of describe some of the clusters that you're finding, whether it's based on municipality or based on something like nursing home settings or other congregate care settings.
Thank you for that. So what we are seeing with our cases continues to be widespread community transmission. That is the primary driver. It's why we continue to hone in on informal settings, indoors, inconsistent groups. If you eliminate those three I's, that significantly decreases the risk of transmission. Outside of that community spread, in some of the other settings, because the increase in the community is occurring, we are seeing increases in congregate settings and some of the other settings where there is more structure in place. So they are not the drivers of clusters or infection, but can be the result of it because of the increase in community spread. That's the overall landscape that we have.
There was an article this morning that Massachusetts is having some significant problems with their contact tracing mechanics. How do we stand compared to our neighboring states? I know that it was certainly a problem here in Rhode Island for a while. Have we caught up? Are we feeling like we're back into a good position with that?
Yes, there are a number of answers to that. With credit to our team, we've done a great job in reducing the backlog that exists. But we've also come up with more innovative, technologically supported approaches. Part of that includes the messaging that we've shared here. The majority of people, once we call them, actually know that they are positive, they're familiar with who their contacts are. We want to make sure people aren't waiting for us. They are taking action. First, accessing the testing that's available. Second, as soon as you are identified as positive, making sure that you begin isolating yourself and that you call your contacts and let them know. Call your place of employment, call your school environment and let them know. As we're getting through this, more and more individuals are familiar with what they need to do and the importance of being able to stay home. That shared responsibility is also allowing us to keep our hands wrapped around the case investigation, contact tracing response. We're including technology and texting people and informing them, allowing people to provide information to us about who their contacts are. These are the ways that we can go forward in addressing the response more creatively.
Because maybe contemplating any actions against the gyms that are flaunting the orders to close.
I'm sorry, you have to
Is the state contemplating any actions against the gyms and other establishments that are flaunting orders to close?
Yeah, I'm going to let the Commerce Secretary answer that because we are deeply in the middle of this.
Yes, we have a system of progressive leaning in to businesses that are either unknowingly breaking the rules or are doing something more flagrant. So first, of course, we communicate with the business. We want to make sure that our policies are understood. And most commonly, what occurs is the business is not fully aware or thought that they were under an exception that doesn't exist, and they immediately remedy. So that's the most common case, and it has happened a number of times during the pause. The second thing that happens is that if they clearly are in violation, there'll be an inspection or at least an observation as to whether they're open when they ought not be. And there is a compliance order or what's called an immediate compliance order that's issued. And we are in the process of issuing some immediate compliance orders. If there is still non-compliance thereafter, there are remedies that can be sought from a legal perspective. And we hope not to have to reach that point, but that could occur. And there are cases where that's possible.
Mr. Pryor,
Governor, what do you think? Sorry.
It's been reported in conversations that literally as we speak, the state of Rhode Island is engaged in an ex parte hearing, I believe in State Superior Court, with the proprietors of Max Fitness of Warren and Lincoln, Rhode Island. The crux of the case, from at least conversations with the business owners, seems to be the arbitrary and, as they contend, the capricious nature of the state to involve themselves in a consensual business relationship between a gym club member and the gym club owners, pointing out that at the same time, they are, in the case of Lincoln, the only business closed in the Lincoln Mall. What is the state's strategy on this? And how far is the state willing to go if, in fact, this starts what happened, we discussed a few weeks ago in Michigan, a wildfire of businesses who, faced with extinction, simply refused to comply?
We have a set of rules that are in place. They are sensible rules that aim at restricting businesses and offering compensation for the revenue lost for closure. The governor has been exemplary among governors in offering that dual policy. So we think we've offered a very reasonable set of restrictions. I, least of all, want to see businesses restricted or closed. But public health officials have indicated which categories of businesses offer the greatest risk and for which closure offers the greatest benefit during the pause. So these businesses ought to close. There are very strong legal arguments that can and will be made pertaining to the public health authority of the state under those circumstances. And it is possible that under such circumstances, as you describe, a temporary restraining order will be sought.
Governor, what do you think of these businesses openly defined?
At what point in time can business owners just allow themselves, in the case of this business, which clearly has an enormous amount of money invested, allow themselves to be placed involuntarily into extinction at the hands of a government who appears to be just picking and choosing arbitrarily? I mean, the only business closed in Lincoln Mall?
I question the premise in that the business might be at greater risk if there weren't compensation, but there is compensation being offered for the revenue lost. Therefore, this is one of the more fair programs in the entire country, indeed globally, as these restrictions have taken place.
Yeah, let me address this. And Brian said, what do I say? It's not arbitrary and capricious. It is in direct response to a public health emergency. Our hospitals are filled, people are dying, and I had to make difficult decisions in order to get the virus under control. Unlike Michigan, at the very same time I put the restrictions in place, we put $100 million out the door to compensate for lost revenue in this 2-week period. So Brian, what do I say to gym owners? I say, follow the law. It is a law like any other law. I am sorry it's difficult. Please, sign up to get the compensation, follow the law, do the right thing. And oh, by the way, if everyone does do that and obeys the pause, it'll only be 2 weeks and we'll be able to open them.
You're almost halfway through the pause. You're 4 days in. So by the time anything potentially happens, what kind of message does this send to the other ones that are following the rules and they're looking around and saying, why don't we just do this if we could have been open half the time?
Because if everybody doesn't follow the rules, then everybody will be shut down longer. That was exactly my point, which is I'm actually heartened that the early data suggests by and large people are following the rules. Mobility is down, bars are closing, most gym owners are just doing the right thing and closing. So if everyone does that, then it will only last 2 weeks. If everyone chooses to not do that, then we'll have to extend it more than 2 weeks. So listen, I know it's hard. I stand by the decision, and I need everyone to follow the rules.
Governor, in Connecticut, from what we understand, the gyms are open. I'm told last night in North Attleboro, there's an Anytime Fitness. There was a line to get in and the lot was filled with Rhode Island cars. So isn't it possible that because we're situated between those two states, that people will find a way, and it's younger people that tend to go to the gym as we're older, but it's easy to go to Seekonk, it's easy to go to Attleboro. It puts the gym owners on the line in a very tough spot.
I know that. I know that. In this, every decision I made, I've said from the beginning, it is imperfect. But I felt it was necessary. And for that 2-week period, those gyms on the border come and get compensation for your lost revenue. And for the young people, and you're right, it's mostly young people who continue to not follow the rules. I don't know what else to say other than to say they ought to be following the rules too, because people are going to get hurt if they don't. So, but basically, like, I know it isn't perfect. I think it was the right decision. I would do it again. And even though not everyone is complying, most are. We follow this. Most gyms are, most people are, most indoor sports facilities in Rhode Island are closed. And so that's a win.
Governor, just to your announcement at the very end of your remarks, what about, don't you feel responsibility to the country? If the leader of the free world asks you, this is an emergency, we need Gina Raimondo to step up, don't you feel some obligation to get involved in a new administration?
As I said, I've said what I've said. I have nothing more to say on that topic. I feel a massive obligation to the people of Rhode Island, and that's why I'm working so hard right now.
Governor, you have heard about and read about the anger surrounding funerals, specifically outdoors. And there's a story in the Journal. I heard from a guy today. His father is being buried with military honors on Monday. Mm-hmm. His family is big enough that some of his own children and all of his grandchildren are not going to be able to go. And with all due respect to the health department, the response is laughable. That an outdoor ceremony with a nuclear family is more of a problem than people going to church 25%, whatever the formula is. And so he's pleading with you. This happens Monday, just as you said for Thanksgiving. If you have a family of 10, if you have a family of 3, what is the problem with saying this family needs to be there? It's one time. I have a friend who's almost my age. She didn't get to go to her grandmother's funeral. She has never gotten over that. And it's been a lot of years.
Yeah. No, I hear you. First of all, here's what I say. These stories are truly heartbreaking. And as you can imagine, my phone lines and inbox are just overwhelmed with these heartbreaking stories of one kind or another. In that case, in the case of funerals, weddings, these once in a lifetime events, we've been clear that we can make exceptions, and they ought to get in touch with us and tell us what you just said. These are the details. It's outside, and we'll see if we can let it go forward.
Outside, I mean, you've said how many times? Outside is better. Outside is okay.
It is. Look, again, you always come to me with like the particular thing. And in that instance, if it is as you say, absolutely.
But it's also endemic of other people. It's one person, but this is going on.
So this is 2 weeks. There's only a very limited, thank God, a limited number of funerals and weddings in a 2-week period. And every one of them is invited to call us, and it's in the regulations. Exceptions will be made. So call us, call Commerce, call my office. We'll work with you. We will absolutely work with you. And if you give us assurance, it will be outside. We will follow the rules. We will be very humane, reasonable, and compassionate.
Just one other question. Across the street, there was a rally going on with the wedding industry people. I talked to you about this over the summer. You said, I'd love to get together with them, be creative. I know they've talked to Commerce. I understand you got the present. They are asking you to help save their 2021 season. So at some point, are you going to sit down? You've got 720 members of this coalition who sat there. What is your message to them today?
Yeah. My message is I'm happy to sit down with them. The money we're just putting out now through the most recent round was specifically designed to include florists, photographers, all of those folks, makeup artists and the like, who are really suffering because of the lack of events. We went out of our way to design it so they could get some of that money. And I am wide open to anybody's ideas in any industry for how to make 21 even better than 19.
Governor, there is a significant outbreak of COVID at the ACI.
Yes.
The medical director of the DOC has resigned.
Yes.
What are you going to do? What is the state going to do to protect inmates and staff of the state prison system?
Yes, thank you for asking that question. So first, you are correct. There is a significant outbreak in maximum security at the ACI. We have 600 cases, and it's a serious situation. I will say we're doing everything we know how to do. The reality is that facility was not built with a public health pandemic in mind, which is to say there aren't even walls in between some inmates or rooms. So while that isn't an excuse, it is an extremely difficult environment in which to control an outbreak once somebody gets sick. What are we doing? We are all over it. We are all over it. We are testing every inmate on a regular basis. Every single inmate who gets sick gets a full medical evaluation. I think there's very few, 2 or 3, who are in the hospital. We're making sure they get excellent medical care, and we're doing the best we can to control the situation. Dr. Clark did resign. I would like to say I'm sad to see her go. She's fantastic. It's a really tough job, and I'm sad to see her go. It's a brutal job and a high burnout rate. She did a fantastic job. We are, however, not missing a beat. Dr. Alexander Scott and her team are in there to make sure there's a transition, and we have doctors from the Department of Health managing that situation. Some people have said to me, hey, Gov, have you considered early release? Let me say this. First of all, I don't have the power to do that. Second of all, earlier in the pandemic, I did work with the courts to provide for a limited early release for a few dozen people who were within 90 days of being released and who were nonviolent, low-level offenders. This is maximum security. These are serious crimes that people are there for, often violent crimes. So apart from the fact that I don't have the power to do it, no, I'm not inclined to do it. What I am inclined to do is work harder and harder every day. We put a congregate support team in there. We put one of our teams in there, just like we do in a nursing home, and we're trying to get our arms around the situation.
Governor, what's the state's plan to distribute vaccines to the inmates at the ACI? Is it something like other close contact settings like nursing homes? Are they included in the plan for vaccines?
Yeah, I'm gonna let her take that.
So yes, we are in development of the details of the plan, but have high-risk populations like congregate settings in nursing homes, as well as the ACI, prioritized in terms of who we will be focusing on giving the vaccine to.
Nursing home cases are spiking again. The state's data shows cases are nearing springtime levels in nursing homes. What's being done differently this time around, or should we just expect the same that we saw in the spring?
What I shared earlier is that the fatality rate connected to congregate settings is significantly less, which is helpful and a reflection of what's been done differently over this time. We have been aggressive with cyclical testing. We've maintained that among all the staff. We've done it for the residents that are connected to an outbreak. And particularly now with the easier form of testing that's been shared, we are reinitiating the weekly regular cyclical testing of residents as well. As the governor mentioned, we continue to have the congregate setting support team. The staff is more familiar with the infection control measures that are needed. And as I shared earlier, now the additional treatments available, particularly the monoclonal antibody treatment, is one that we are looking to really prioritize our congregate setting populations to use.
Doctor, are there concerns about mental health issues during this pause, the isolation? What resources are available, or are you sort of prepared to handle an influx of mental health issues?
The mental health concerns have been a priority throughout this entire pandemic. You know, the focus on connectedness that is so critical from an emotional wellness standpoint has been challenged when you have a pandemic novel virus such as this that requires the type of isolation to prevent spread. So we are able to leverage our Health and Human Services Secretariat and agencies, work closely with the Department of Behavioral Health, Developmental Disabilities, and hospitals, as well as our staff within public health, to really continue to build a response that is going to be a unique element that will continue probably long beyond the vaccination and the hopeful time that we have for the spring. So it absolutely is a focus during the pause, has been prior to, and will continue to be a focus for us to make sure resources are available and a key part of our response going forward.
Dr. Governor, there are states, and you've expressed your aversion to going toward a lockdown, but there are states that are moving in that direction. Is there a likelihood that's going to happen here?
I can. Sure. We have really assessed that in great detail. You know, I credit the governor. We're one of the few states in the region that have been thoughtful in being able to apply the pause that's in place. And our assessment of the data shows that the pause with a slow dial-up during the time afterwards can give us a similar impact to having the full-on shutdown while balancing the key components of commerce and the economy and overall public health that we know are critical. So Rhode Islanders can know that we've taken the most thoughtful, data-driven approach we can, taking into account how to best quell the virus and also preserve the economy and overall public health for the long term.
There was a person who wrote earlier this week about that they use a gym for immunotherapy. I wrote to the health department to kind of get an answer, and the response was anybody who uses the gym for immunotherapy or therapeutics may do so based on whether it's a doctor's note or otherwise. How do you enforce these types of specific instances? You know, are you going to regulate gyms? Are you going to check? How do you manage through this pause when there's going to be person after person that has a specific reason why they should be able to do something that the population is supposed to not be doing?
Well, we recognize the 2-week time period. Oftentimes such types of therapeutic options require 1 or 2 week visits or interventions during that time. And really, it's a credit to the partnership that we have across our whole of government state response. Commerce, our Department of Business Regulations, Department of Health, taxation, and others are going to continue to work closely with business owners. We trust those that know that there are therapeutic needs that are in place. That's a critical option to be able to maintain during these 2 weeks. And are going to continue to work closely with ensuring that that is available for patients while maintaining the overall pause that's needed with closing gyms, decreasing the risk of spread across our state during this 2-week time frame.
Governor, I know we just got past Thanksgiving, Hanukkah, I think it's next week, Christmas is 3 weeks away. Are you prepared to tell people that they shouldn't be getting together for the winter holidays here?
I'm not saying that now, but I'm prepared to do it if I think that's what's needed. The point of the pause was to tamp things down so that Christmas and Hanukkah and such would be better than Thanksgiving, but I just don't know.
I was going to ask the doctor a question concerning the treatment. You had mentioned that if you test positive, you should take the new treatment you've been talking about. Is that across the board you're suggesting that anybody who tests positive?
There are specific populations that I reviewed that with, certain older individuals as well as people who are immunocompromised or have some form of underlying illness. So the key is to definitely know that that option is available and be able to connect with the provider. We're also expanding different mechanisms for people to be able to access this very new, very promising available treatment approach for people prior to admission into the hospital that have the specific qualifications that I've shared.
Thank you.